The job description of a nurse practitioner revolves around delivering advanced healthcare services that combine clinical expertise in diagnosing, treating, and managing both acute and chronic conditions. Nurse practitioners, NPs, are highly trained and licensed professionals who serve as primary and specialty care providers, offering a patient-centered approach that integrates health education, disease prevention, and evidence-based practice. They are often the first point of contact for patients, providing high-quality care in hospitals, clinics, private practices, and community health settings. Nurse practitioners bridge the gap between registered nurses and physicians. Their expanded scope of practice allows them to perform physical exams, order and interpret diagnostic tests, prescribe medications, and develop treatment plans. They may specialize in areas such as family health, pediatrics, geriatrics, women's health, or psychiatric care. Depending on state regulations and institutional policies, nurse practitioners may work independently or in collaboration with physicians. The role of a nurse practitioner is essential in modern healthcare systems, especially in regions facing physician shortages or where accessible, affordable care is a priority. Through a holistic and empathetic model of care, NPs not only treat illness, but also empower patients to make informed decisions about their health and well-being. Core responsibilities of a nurse practitioner. A central responsibility in the job description of a nurse practitioner is performing comprehensive patient assessments. This includes collecting medical histories, conducting physical exams, evaluating symptoms, and identifying potential health risks. Nurse practitioners rely on their clinical judgment to determine the appropriate diagnostic tests, such as blood work, imaging, or lab screenings, and interpret the results to reach accurate diagnoses. Once a diagnosis is made, nurse practitioners are responsible for developing individualized treatment plans. These plans may involve prescribing medications, recommending lifestyle changes, or initiating therapies such as physical rehabilitation or counseling. They monitor patients' responses to treatment, make necessary adjustments, and provide follow-up care to ensure progress toward recovery or effective disease management. Prescriptive authority is a key aspect of the nurse practitioner's role. In many regions, NPs are licensed to prescribe medications independently, including controlled substances, provided they adhere to clinical guidelines and legal frameworks. Their prescribing decisions are informed by patient history, potential drug interactions, and evidence-based protocols. Health education and preventive care form a cornerstone of the NP's duties. Nurse practitioners spend considerable time educating patients about disease prevention, proper nutrition, physical activity, smoking cessation, and stress management. They provide vaccinations, conduct routine screenings, and offer counseling on maintaining a healthy lifestyle. This preventive focus helps reduce long-term healthcare costs and improves community health outcomes. In addition to direct patient care, nurse practitioners are responsible for documentation and record keeping. They must accurately chart patient encounters, test results, treatment plans, and medication changes in electronic health records, EHRs. These records are essential for continuity of care, interdisciplinary communication, and regulatory compliance. NPs often serve in a collaborative capacity, working alongside physicians, specialists, therapists, pharmacists, and social workers. In multidisciplinary teams, they contribute valuable insights, advocate for patient needs, and coordinate care across services. In rural or underserved areas, where physicians may not be readily available, nurse practitioners often serve as the lead healthcare provider. Midway through these multifaceted responsibilities, it becomes evident that the job description of a nurse practitioner extends far beyond routine care. It encompasses leadership, critical thinking, advocacy, and a deep commitment to comprehensive, compassionate, and patient-first service delivery, essential skills and competencies. To succeed as a nurse practitioner, individuals must possess a wide array of clinical, interpersonal, and analytical skills. First and foremost, advanced clinical knowledge is essential. Nurse practitioners must have a thorough understanding of anatomy, physiology, pathophysiology, pharmacology, and diagnostic procedures. This knowledge enables them to assess complex health conditions and deliver effective treatments. Critical thinking and decision-making are vital competencies. NPs must synthesize patient information, lab results, and clinical guidelines to make informed decisions in fast-paced and sometimes uncertain situations. Their ability to think quickly and accurately is particularly important in emergency settings or when managing multiple comorbidities. Communication skills are indispensable. Nurse practitioners must convey complex medical information in a way that is understandable and reassuring to patients. They must also listen attentively to patient concerns, collaborate effectively with healthcare teams, and provide clear instructions for care and follow-up. Empathy and emotional intelligence are defining traits of a successful NP. Patients often turn to nurse practitioners in moments of vulnerability, when dealing with pain, fear, or chronic illness. The ability to connect with patients, build trust, and offer comfort is essential for patient satisfaction and adherence to treatment. Leadership and autonomy are increasingly important, especially in roles where NPs serve as primary care providers. Nurse practitioners must be confident in their abilities, capable of working independently, and ready to take initiative in clinical decision-making and patient advocacy. Technical skills, including familiarity with EHR systems, diagnostic tools, and telehealth platforms, are crucial in today's healthcare environment. Nurse practitioners must stay current with emerging technologies and integrate digital tools into their clinical practice to enhance patient care. Time management and organizational skills allow NPs to manage demanding caseloads efficiently while maintaining high standards of care. They must juggle appointments, documentation, patient education, and follow-up activities while remaining focused and attentive. Work environment and challenges. Nurse practitioners work in a variety of settings, including hospitals, outpatient clinics, private practices, long-term care facilities, schools, correctional institutions, and even patient homes. Their work environment is often busy and unpredictable, requiring flexibility and adaptability. The job can be physically and emotionally demanding. Nurse practitioners may stand for long periods, handle medical equipment, and be exposed to infectious diseases. They also face emotional challenges when delivering bad news, managing end-of-life care, or supporting patients with mental health issues. One of the ongoing challenges in this profession is navigating the scope of practice regulations, which vary by country and state. In some regions, nurse practitioners enjoy full practice authority, while in others, they must work under the supervision of a physician. Advocating for expanded practice rights and overcoming institutional resistance can be part of the professional landscape for many NPs. Additionally, nurse practitioners often serve populations with limited access to health care. This includes rural communities, low-income patients, or those without insurance. Working in such environments can be rewarding, but also requires resourcefulness, cultural sensitivity, and resilience. Despite the challenges, many nurse practitioners find the work deeply meaningful. They form lasting relationships with patients, witness the results of their care firsthand, and contribute to community health in a tangible way. Education, training, and career development. To become a nurse practitioner, individuals must first earn a registered nursing (RN) license, typically by completing a Bachelor of Science in Nursing (BSN) and passing the NCLEX RN exam. From there, they must pursue a graduate-level education, usually through a Master of Science in Nursing (MSN) or a Doctor of Nursing Practice (DNP) program, with a focus on a specific population or specialty. Graduate programs combine advanced coursework with clinical training. Topics include advanced pathophysiology, pharmacology, health assessment, and clinical rotations in various settings. Specialization options may include family practice, pediatrics, adult gerontology, women's health, psychiatry, or acute care. Certification by recognized bodies, such as the American Nurses Credentialing Center, ANCC, or the American Association of Nurse Practitioners, AANP, is required for practice. Certification must be renewed periodically through continuing education and clinical hours. Ongoing professional development is a hallmark of the NP role. Nurse practitioners are encouraged to attend conferences, pursue certifications, and stay updated with clinical research and best practices. Some NPs further specialize or pursue leadership, academic, or policymaking roles. Conclusion. The job description of a nurse practitioner reflects a profession rooted in compassion, expertise, and commitment to health equity. These healthcare professionals provide much more than clinical treatment. They offer a comprehensive approach to care that considers the physical, emotional, and social dimensions of health. As the demand for accessible, high-quality healthcare grows, nurse practitioners are becoming indispensable members of the medical community. Their ability to diagnose, treat, educate, and advocate positions them as trusted allies in patient care and public health. For individuals passionate about medicine, patient interaction, and lifelong learning, The role of a nurse practitioner offers both profound responsibility and deep professional satisfaction. In every exam room and clinic, they continue to make a lasting impact. One patient, one family, and one community at a time.